We are pediatricians lovingly taking care of millions of children across the country, but not understanding that healthcare is going under a radical reform. And right now we've got a major change happening in that consumers, patients in particular, are under tremendous pressure because of increases in productivity and stagnation of wages. And just like the digital revolution and all these other things oriented toward consumerism, physicians are not understanding that patients are going to retail clinics, they're doing healthcare on their smartphones, they're needing to be in a hurry because they have two parents working and the kids aren't, need to be in school. So our medical model is not kept up.
Well, I think that we are putting together both some of the most interesting examples of clinical activities, some of the most interesting research in this area, and some of the newer policies in this area. So we brought together a group of people who really are on the cutting edge of what's happening to help people make interesting plans for themselves.
Well, I want them to understand a couple things. First, that number one, we do have some tools that we can use if we partner together. We have to stop fighting the old battle of saying people shouldn't go to retail clinics, people shouldn't use their iPhone apps for medical care, they shouldn't do this, they shouldn't. No, we should embrace these things and figure out what's the best way to use those things. What's the best way to integrate them into our pediatric healthcare system? And how do we partner with these new kinds of providers and opportunities? And pediatricians need not to play the last ones to the game role, but rather this is what children need role. And so when they do that, then we have some models where that's starting to happen, and those places are successfully caring for kids and keeping pediatricians and their partners active at the table.